Hello, and welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens. In this week's episode, we're going to be talking a little bit about design in artificial intelligence in healthcare and ethical design in artificial intelligence in healthcare. We're going to talk about unintended consequences of some design choices that get made and the ways in which people with the best of intentions can end up creating a product that doesn't do what they thought it was going to. So let's get started. I started my research for this week actually by doing, I guess what in politics might be called oppo research. So I got kind of sucked into some stories about AI gone awry, right? AI generating wildly unethical results, like United Health using their AI model that somehow just rejected 90% of claims. I was doing some deep reading, and I'd like to go back and I'd like to do a deeper dive on this, but a nurses union recently came out against the use of AI in care, and I was reading through some of their talking points about the concerns that AI was being used to artificially lower the level of staffing that was needed, concerns that AI was going to replace skilled nursing decisions and skilled nursing judgment. And so I was taking all of this on board and kind of thinking, well, some things are clearly wrong. Some things I wonder, is this really true? And then I thought about a couple of things actually. So one of them was the fundamental attribution error, which is one of my very favorite cognitive biases, right? Which says that other people make mistakes or have bad outcomes because they made decisions that were stupid or bad, or it shows a fundamental flaw in their character, right? So in the example of our insurance company, they used an AI model that for whatever reason denied 90% of claims. They did this because they're evil, right? This is a fundamental attribution error. If I did something that had such a bad result, it would be because I didn't have all the information or my model wasn't properly optimized. And I started to really think, okay, how do we avoid these kind of outcomes, intended or unintended, when we're deploying AI in the healthcare space? I don't know if I've spoken about this before on my podcast, but I have children. They are 11 and 8, and like most children of nerds, they are very into YouTube scientists, and they are particular fans of Mark Rober. Love Mark Rober, big fan of his as well. But I was thinking about when he was trying to do a Guinness World Record breaking egg drop. He was trying to drop an egg from space. He was trying to get it targeted to a specific area, and he was running into a lot of trouble. So he called a former mentor of his at NASA who just said very kindly, like, my dude, you are trying to make a ballistic missile targeting system only for an egg. Everybody who can help you with this is not allowed to speak to you about it. And you should not put this up on YouTube for other people to replicate. That's unethical. And you could just see this wave of realization wash over his face. He hadn't really thought about the implications of trying to drop an egg from space. So sometimes when we operate with the very best of intentions, we don't really always think about the unintended consequences, because of course that's not what's on our minds and in our hearts. We're just trying to make life better for people. So for the purposes of this podcast, I wanted to start an illustration, which I think I'm going to come back to. I need a fictional health system, right? I do not want anybody to think that any of my comments or my ideas here are representing work that is happening or is conceived of happening at Cleveland Clinic. They pay my paychecks. They give me my day job. This is not this is totally fictional. So here, Jenny's totally fictional health system right here. I used DALL-E to come up with this image. It's not great, but it's got the spirit, right? Our sign is a little bit wonkus, but you know what? We're doing the best we can for a totally fictional health system. So at Jenny's totally fictional health system, we're going to trial a new tool to predict coding and billing based on an outpatient note, right? This is cool. This is technology that is out there today. And then I just wanted to illustrate, and I spent a lot of time trying to get DALL-E to actually understand what a note looks like and what predicted codes might look like. And I got this, and then I gave up. So instead, I'm going to invite you instead to look at this draft note and a list of predicted codes. Cool, right? Medical coding and billing is skilled work, right? But if we can use our text that our doctors have painstakingly written to predict a list of codes, that might actually speed up the process. So this is cool. This is interesting. We're going to try this out at my fake health system. And in my fake health system, because it's populated by fake people, everybody loves it. It's great. We're working with our vendor. We're putting in a couple of updates. We're going to make this even more efficient. We want to be even more efficient, so we want to set our AI to display only the top 5 or 7 most likely codes. And then we're also going to update our learning algorithms so that we think it's going to be more accurate. So because we don't want to unnecessarily bias, right? We want to make sure that we still have all of the potential predicted code options available to us. We are just going to hide the rest under a dropdown, right? Okay, so let's back up. There's a couple of things here that are giving me pause as a person who is involved in the implementation of AI in this space. And this ties back into some of the reading that I was doing earlier this week on design in AI, and in particular, what used to be called dark design, which is a super cool name. Everybody should call it that still, but instead we've moved to a slightly more neutral deceptive design. So these are the kind of patterns that make it really easy to sign up for a service, but almost impossible to cancel the service. These are the kind of web design decisions that might leave your unsubscribe link in white at the bottom of the email, so it's impossible to find. This is the kind of design that might pop up 2 or 3, what do you mean you don't want 15% offs, as you're trying to just find the pair of pants that your friend sent you. So thinking about design and patterns and deceptive patterns in artificial intelligence. So going back to this, let's look, that drop down, right? That drop down is a barrier to making a full review of the list of codes that were selected for you by our technology. In an ideal world, we wouldn't have that, right? We would have a full menu presented. But I want to take even one step further back. Think about going to the grocery store, right? You have many options available to you. You are limited only by your family's tastes and allergies and your budget. You can select whatever meals you want and ingredients for whatever meals you want at the grocery store. Versus going to a restaurant, you're presented with a menu. And 90% of the time, 95% of the time, you're just going to order off the menu. It's been pre-selected for you. I would argue that the pre-generation of that list is also a bit of a barrier, and we need to be really thoughtful about making sure that any reasonable option is available to our providers on that list to select from. So pre-selection of choices, and I would also argue pre-curation of choices, can bias our clinical actions. This is something that I want to dive a little bit more into. But I'm curious to know, this is a place where we can really get some closer integration of a human in the loop. Can we make it really easy to add a selection to that list? If we need to suggest for coding for a code that wasn't on the list, can we suggest that, hey, we need to bias this in a different direction? If all of our billing and coding is suggested incredibly complexly, does that have financial implications for our health system? Does that have financial implications for our patients? What does that do to our downstream denial rates? There's a lot of potential for efficiency that may have unintended consequences, and it's helpful to think about this stuff up front before you get this tool in your system.